Ding.
All right.
Actually,
To palpate middle scalene.
Nope.
Nope. Come on around.
Start again.
Waiting for James.
James,
there's
come over here.
space right there for you. Okay, we good?
Yes.
All right. To palpate middle scalene, working in the lateral aspect of the neck, and to approximate the proximal attachment, I'm going to come to Lisa's ear and drop posteriorly to find the mastoid process, which I'll leave my hand there, and then just come to the top of the shoulder or the top of the clavicle and just visually estimate the length of the cervical spine. Close to the inferior, or within the inferior half, I'm going to lay 3 fingers very lateral, and this is a good estimation of C4, C5, and C6, where the middle scalene attaches to the posterior tubercles of the transverse processes. So I'm just going to palpate, make sure that I'm lateral enough. Here we are on the most lateral point of the transverse processes. You can see I'm going over a structure that seems to be about the same girth as going over like my little finger like that. Can you guys get a sense for that? That's what you want to feel for in there. Okay, so 4, 5, and 6 posterior tubercles on the transverse processes. So this muscle travels inferiorly from there. Notice I'm staying on the lateral side this time, and make sure you're in front of trapezius, right? So if I pinch here, you're anterior to trapezius, but staying very lateral to the transverse processes, and I'm going to palpate as inferiorly as I can, because I'm trying to head to the distal attachment. So this is about as far as her tissues will let me go. The distal the action of this muscle is that it's a respiratory muscle. It's going to lift the first rib on deep inhalation. It will also be a synergist to side flexion and forward flexion, but I'm going to use the respiratory action to get this muscle to work. Lisa, if I could ask you to take a very deep breath, fill your lungs as big as you can, and hold it for 5 seconds. Right at the top of her breath, I felt a hard surface come to the tip of my finger, and along the length of my finger, I felt the tone of the muscle increase. So just feeling, just kind of bang, bang, bang into that first rib there. The distal attachment, and you can release your breath now. The distal attachment is the anterior surface of the clavicle adjacent to the concavity. And you can relax, and it is, hang on, it is lateral to anterior scalene and innervated by the local rami C4, 5, and 6.